Hey, it's Steve Grant here from stevegranthealth.com, and today I'm joined by one of our clinicians, Isabelle, who is a specialist health coach, and we are working together to help support our clients to get better results. Now, what we wanted to do in this video was to kind of introduce the concept and the idea of how a functional medicine practitioner and how a functional health coach work together to help clients get better results and to help them achieve their goals. So I think what we're going to do is we're going to kind of overview what functional medicine is, some of the roles of a functional medicine practitioner, and then we're going to kind of flip it over to what a functional health coach is and how functional medicine practitioners and health coaches basically engage together to support their clients. So I'll just hand over to Isabelle to say hello before I kind of jump in and start talking about functional medicine, and then we're going to jump back to you. So you can kind of do a little mini introduction if you want to, Isabelle.
Yes, hi, I'm Isabelle, and I've recently joined the Steve Grant Health team, which I'm really excited about. I am a functional health coach, which I train at Chris Kresser Institute of Functional Medicine, and I'm basically a behavior change expert, which we'll dive into more in the following conversation.
Cool, perfect. So I'm just going to kind of outline what functional medicine is to start off with, because a lot of people still wouldn't have necessarily heard of the concept of functional medicine, and really it's a concept of how we choose to work with clients to support them on their health journey. So it's very much a kind of patient-centered approach, and it's something that involves looking at someone from a kind of whole systems approach. So we think about how all of their systems are interacting with one another, and then we also think beyond that in terms of how them as an individual, as a person, is interacting with their environment as well. And that could be their nutrition, their lifestyle, it could be past stress, traumas, that type of thing, and how that's affecting them perhaps physiologically and mentally and emotionally at the same time. Now, in terms of the role of a functional medicine practitioner is to really, because that's obviously quite a broad thing to do, right, is to look at everything on a whole level. So the role of a functional medicine practitioner is to really try and engage with their client to understand their journey, what's kind of got them to that point. So it's really about listening to that client. It's about assessing them as well, and that could be symptom assessment, it could be using kind of clinical lab assessments to kind of guide the process a little bit, and then kind of telling the story back and discussing with that client what we feel is going on. So, pulling all of that information together about their nutrition, their lifestyle, any assessments that they might have had, their history, family history, all of those things, and then trying to just kind of relay a little bit of a story of how they might have got to where they are at the moment. The next kind of step for us as functional medicine practitioners is to try and plan and create essentially what the roadmap is. So how are we going to kind of get them to whatever their goals are based upon all of this information that we've kind of gathered from that individual. And I think this is then the next sort of step, which is quite interesting for a functional medicine practitioner, is that it's one skill to be able to kind of assess and kind of understand where that person is, maybe what the roadmap is and what we want them to do to help get them to where we want to get them to. The next kind of challenge is how do we actually help someone do that? So what are the practicalities involved with being able to take someone from A to B or A to Z, or however long that journey is going to be for that individual. So I'm going to hand over to here. I'm going to ask a question to you now, Isabelle, which is, what's the role of a functional health coach?
So a functional health coach, in essence, is a behavior change expert, and we are trained in behavior change, motivation, psychology, basically everything that ties into that. And we help clients make successful long-term behavior change and increase motivation as well, and then particularly intrinsic motivation, which is the internal type of motivation that is shown to be more powerful. So quite often what we see is that people kind of know what they need to do for themselves. They know they should either move more or eat less sugar or whatever it is, sleep more. But they struggle actually implementing this and getting to the change that they want to make. So there is a gap between what they want and how they're behaving, and they don't know really how to bridge that gap. So what a health coach does is they help a client figure out what works best for them in their situation and how they can most effectively implement that change. because everyone's completely different. A mother of 2 young children has a completely different schedule than a busy lawyer, for example. And it is really about teaming up with that individual and through conversation and questioning, helping them figure out in what way that works best so that they can implement changes that they want to make sustainable, long-term, and therefore successful. And
in terms of kind of like what are some of the classic challenges that clients face? Like what are some of the kind of, I guess, blocking factors for behavior change for clients, the sort of things that you would come across?
So what we often see is that people are very motivated at the start. They jump in head first. For example, they want to go to the gym more, so they say to themselves, I'll go to the gym every single day this week. And they try and do that, and they're probably successful for a few days, but after, let's say, 2 or 3 weeks, something gets in the way and they fall off. And a few things happen then. First of all, they haven't at the beginning completely analyzed their challenges that they're going to face, and therefore haven't prepared in advance what they're going to do about that. When they fall off, they feel frustrated because they've set their own standards too high, almost so high that they were really setting themselves up for a quote unquote failure because they can't meet their own standards. So they feel frustrated and they feel like they failed, which usually gives them like decreases their confidence, decreases their motivation, and they revert back to old patterns. So really it's about helping them navigate the challenges, making them plan like having them make a realistic plan and helping them see kind of those setbacks as learnings to help them kind of overcome these challenges and stick to it for a longer period of time.
Yeah, I think it's interesting because I think you've also got, from the perspective of a functional medicine practitioner, there's certain challenges that we would face as well, like when we're working with clients, in the sense that, and it's a challenge for the clients in that when you're doing this massive assessment of someone, you're trying to figure out kind of what's going on. You're looking at all these broad areas and putting all that information together, and then trying to create a bit of a roadmap for someone. That's a lot of information to take on board. And then potentially the risk with that as a functional medicine practitioner is that it's very common that we end up just giving someone too much information, too many things to go away and do to try and get them better. You know, it's kind of, as practitioners, we're trying to give them as much as we can, but equally at the same time, sometimes less is better, or having someone there to sort of coach and support them and have that kind of regular accountability, and someone specialist in kind of behavior change. I think that's kind of where this connection between the functional medicine practitioner and the functional health coach is really going to kind of become more apparent as people engage more in the kind of functional medicine approach. Is that kind of how you see things kind of working?
Yes, definitely. Because at least in my experience, when people work with a functional medicine practitioner, they usually get like a treatment plan or an assessment, and it covers quite a lot of lifestyle, diet changes that are very new to them. And some of that might be very easily implemented, but some areas they might struggle with, especially if they're quite drastic from the way they have always done things. So I suppose where a health coach could come in that particular scenario is that we help people take this overall assessment, break it down into very actionable steps, help them prioritize, see where the quick wins are, and where they need most support. And then in follow-up sessions, really tackle each component individually, really focusing in and honing in and discussing that individual component so that they are set up to gradually implement everything successfully and not feel that kind of overwhelm that you just described.
Yeah. So how would you see it kind of working then, like in terms of functional medicine practitioner, health coach working together? Like what would you see as the client journey? Is it, you know, someone works with that functional medicine practitioner, the functional medicine practitioner kind of creates that bit of a roadmap and then pulls in? Because I think there's a couple of ways in which a health coach can be involved. One is that actually what you said earlier, which is a lot of people actually do know what they need to do, and sometimes they don't actually need to see necessarily a functional medicine practitioner at all. Like they need to work on more foundational areas, and they could probably just do with support from a behavior change and accountability and that sort of perspective. And then you've got the other side of it, I guess, which is trying to develop a roadmap and understanding more about what's going on, and then kind of creating change. So yeah, like that's the way I see it. Is it a similar thing for yourself?
Yes, definitely. There's quite two distinct areas. I feel like some people could benefit big time from just working on the fundamentals, like improving the sleep, moving more, changing their diet, working on kind of stress management techniques. And for them, that could solve quite a few issues. So focusing on that first, you don't really necessarily need to see a functional medicine practitioner yet. However, if that doesn't cut it, or if there's deeper underlying issues, then yes, of course, there you need to see a functional medicine practitioner. And then I think ideally where a health coach could complement that is after you've had the first initial consult and you've outlined kind of the changes that you need to make. Ideally, you would bring a health coach in quite soon, especially if the client seems a little bit taken aback about the changes. Some people might be very confident making 10 changes from one day to another, and that's great. But other people might not be that confident, or not know where to start really. And I suppose a health coach could come in quite quickly after the initial consult to help break them down, prioritize, and make like an actionable plan from that day until they next see the functional medicine practitioner, to try and help make them get the most out of that plan that you've then like put together for them.
Yeah. So kind of the main benefits of working with both a health coach and a functional medicine practitioner are kind of going to be the ability to, I guess, to prioritize and break down some of the areas that you're wanting functional medicine practitioners want in that client, and that client's agreed to sort of like working on. I guess like as a functional health coach, you would tend to probably have a little bit more contact with that client. So you've got regularity and accountability in terms of that. So that allows you to then break down into more bite-sized sort of pieces, I guess, the changes that someone's looking to make, so that then they don't feel overwhelmed. But also, I guess, from the perspective of building confidence as well, right? That's a big part of sort of someone on their health journey is, and I've seen it, and I hold my hands up. Like there's been times where I know that I've given people too much information, and it knocks their confidence, because I might have given them a bunch of things to do, and human nature is that we often focus on the things that we haven't done rather than the things that we have done. So even if that person's done a great job with like a few areas, if there's one or two areas that they haven't done, the natural instinct is to kind of almost focus on that and beat yourself up a little bit about that. Which I guess some of that is also where a functional health coach works with someone in terms of reframing that and actually trying to help build confidence and help to sort of see that not everything has to happen at once, and that things can go in stages. And as long as we're kind of moving towards that journey and we're starting to see some results from it, whether it takes 1 week to implement all of these things or 10 weeks to implement those things, as long as the movement or the or some level of progression towards what their goals are, that's ultimately the most important thing, right?
Yes, definitely. I completely agree. If people set their standards too high or try to many things at once, and then they kind of miss the mark, so to speak, or they didn't have everything sorted that they wanted to, it can definitely cause them, as you say, to decrease their confidence. And I think working on the mindset in that respect is incredibly important, because first of all, yes, you want to celebrate every single step that you take, even if it's as small as, oh, I looked at a local gym. You already want to celebrate that success because it's one step further than you were a week ago.
Yeah.
And another aspect of that is if something doesn't go so well, or if you're trying something and it doesn't work, that is not a failure. Like you can't see that as a failure, because it's just showing you how you work, and what doesn't work for you just brings you a step closer to what does work for you. And it's really figuring out this individual aspect as well, like what works for you and what do you need to make sure to implement these changes, because that's different for everyone. And sometimes you take clients through a little bit of a self-discovery process alongside implementing these changes, because they really just learn about themselves, what they need to have in place to in order to be successful both now and in the future.
Yeah, because I guess in some degree you're teaching the ability to actually, like, failure is the wrong word, right? So it's almost like, how do we respond to the perception of failure, and how do we actually use that as a positive to then go, okay, well, that didn't quite work, but what can I do that actually would help me do that? And then sort of it's always interesting having that conversation. A lot of the time, and I'm sure you'll certainly acknowledged this as well. A lot of the time people have the answers within themselves, right? It's just that ability to have that conversation, and it's very hard to have that conversation by yourself internally in your head without necessarily having a certain kind of question that would cue you to sort of dig a little bit deeper to try and find the solution or the answer that is specific to your individual circumstances. And I think, that's the joy of kind of like behavior change coaching, that it really kind of it dials in on the personalized approach, which is all what functional medicine is ultimately meant to be about. But I think the challenge is sometimes with functional medicine is that it misses this aspect of it, which is how do we personalize it to fit into someone's lifestyle, not just, we're going to look at your body on a physiological level and we're going to personalize what we need to do based upon the imbalances that are going on. It's then kind of going, actually, we look at that, but then we go, how do we now transfer that into the real world? And how do we allow you to be able to navigate what we're trying to do with all of the other commitments and other things that you've got going on as well? So just to kind of finish off on things, because I think we both sit in the same kind of boat in this. That's probably why we work together. But in terms of kind of the collaborative care sort of model, what do you kind of see as the future for healthcare within functional medicine, within collaborative care? Like, what's your sort of vision moving forward with that?
Oh, good question. So I think ideally, and we are far away from that in England, but I think you specifically with your practice are really trying to move towards this, is having a team of different practitioners to support each client. So having a functional medicine practitioner kind of do the assessments and diagnose and come up with a treatment plan, but then being able to pull in different experts from different fields to really fully support the client in every single aspect of their health. So that might be working with a nutritional therapist or with a mindfulness coach or with someone like me, like a behavior change expert, really dependent on what that client needs, but to be able to meet every single aspect of their kind of lifestyle and health related lifestyle, all because everything contributes to health. Health is such a gigantic spectrum of factors, really, that you want to cover multiple bases to be able to give that client the full support that they need to reach optimal health.
Yeah, and I think everyone needs a slightly different approach, right? And people are going to suit different practitioners based upon what they've got going on, what their background is, and what their goals are. And I think that's why we've moved. I mean, even if you look at functional medicine practitioners, I guess pick up on one point there, like one of the roles of a functional medicine practitioner is to figure out what the support team might need to be around that individual as well. Like that's a big part of what a functional medicine practitioner might need to do, whether that is actually referring back into potentially more conventional settings for specialists that work in that area for further investigation to something very specific, or whether it's kind of pulling in like a behavior change coach or mindfulness therapist or whatever it might be. So yeah, I think it's about trying to just integrate these practitioners that have these kind of different specialisms within kind of a broad sort of functional medicine model, basically. And even just looking at like functional medicine practitioners, it's like you have to be a relatively good generalist anyway, because you're using this kind of systems-based approach. But equally within that, it's also very hard for a functional medicine practitioner to be that specialist amongst multiple kind of like areas within the body. Not to mention then behavior change and, the psychology of various different things as well. So I think it becomes just a tad unrealistic to expect probably a functional medicine practitioner, and for the functional medicine practitioner to have that expectation on themselves that they should be delivering all of this information, because I think we should respect the training that goes into each of these individual areas of the practitioners and what they bring to the table. And ultimately, if we're going to talk about it being a patient-centered approach, the approach that we want to take is we put around them the most skilled people to be able to support them, basically. Like I've always used the analogy of like when you look at, say, an athlete, for example, an athlete will have a team of people, like, a high performance athlete will have a team of people around them working to get the most out of their physical performance and to allow them to sort of peak towards a specific goal. And I don't think it's actually any different when we're looking at kind of like healthcare. It's like, what are the things that we need to put around you to get the best possible results? And for me, that kind of collaborative care model of having clinicians that have this broader functional medicine mindset, which I think is important, but then potentially having their own specialisms within those areas that they're able to kind of work with clients on as well, is good both for the client, but also for the clinician to kind of have their own little niches and specialist areas within this sort of like broader generalized approach as well. But yeah, so I think we'll wrap up there anyway. I think that was a really interesting conversation, just kind of introducing this collaboration between a functional medicine practitioner and functional health coach. We'll probably do some future videos together. I know you're going to do some videos yourself, and we're putting up a bunch of written content that you're producing as well in the coming weeks. So we'll be sure to kind of add links to that with this video, or put it out in our newsletter as well. So thanks, Isabelle. Anything you want to add?
No, thank you very much, Steve. I think that covered most of it, and I look forward to working together.
Brilliant. Cheers, Isabelle.
Thanks, Steve.